I'm Dr. John McCann, and I'm going to talk about eyelid, eyebrow, and forehead lifting surgery. The two common problems that occur in the upper eyelid are an excess of skin and fat in the upper eyelid, which we call dermatochalasis, as well as a stretching out of the tendon in the upper eyelid, which is called ptosis. The upper eyelid is a very detailed structure, and its precise appearance has a lot to do with how we identify ourselves and how other people identify us. So surgery must be done in the upper eyelid in a very precise fashion. It is fairly easy for you to assess yourself to determine whether or not you only need eyelid surgery or if you need eyelid and eyebrow lifting surgery. Simply close your eyes and relax your forehead while placing your fingers over the lateral part of your brow. Once the forehead is completely relaxed, feel where your eyebrow rests. If it rests firmly on top of the bony ridge, then you don't need an eyebrow lift. If it falls beneath the bony ridge, you're someone who would benefit from an eyebrow lift. In general, insurance companies will pay for eyebrow lifting surgery if when you close your eyes and relax your forehead, your eyebrows fell well beneath the bony ridge and you have symptoms of loss of peripheral vision. However, insurance companies will only pay for something called a direct brow lift. And a direct brow lift is in a surgery where there is an incision made in a visible location. Unlike the upper eyelids, the eyebrows tend to scar when an incision is made in them. There are procedures that can be performed with all the incisions made behind the hairline to lift the brow in a way that does not leave any visible scars. These are not covered by insurance companies. It's very frustrating to patients that the best methods for lifting the forehead are not covered by insurance companies. I have a whole armamentarium of procedures I use to lift the brows, and I base my decision of which surgery I will use on a lot of different factors. For instance, the sex of the patient can make a big difference. Men tend to want fairly flat eyebrows, where women more commonly want a little lateral flare. I base it on how many furrows there are in the forehead. I base it on the age of the patient. Where the hairline is at is a very important issue. And then I have to talk with people about what procedures would be covered by their insurance companies and which ones won't. We are wired to interpret other people's emotions by their facial expressions. And when we see people who have eyebrows which are downwardly slanted, we interpret their facial expression as being sad or sometimes even stern. And by simply lifting their brows a few millimeters and giving them a flat, or in women's case, a slightly upward slant to their eyebrow contour, it can totally change the way other people interpret the way you're feeling. Being able to make someone look nicer and at the same time alter the way other people respond to them and have people respond to them in a more positive fashion is both very rewarding for the patient, and it's very gratifying for me to be able to do